Hello, everyone, and welcome to another session of the Collateral Nation with Dr. Chris Seenan. He is the Global PAD Association's Global Walking Therapy Researcher of the Year, and he is so kind to donate his time to answer questions about walking as medicine for a disease more prevalent and deadlier than most cancers combined. It is poor circulation in the legs, known as peripheral artery disease, and that's blocked arteries in the legs due to plaque buildup. But there is so much for those who are diagnosed that they can do on their own to improve their prognosis, and walking is absolutely number one. And that's why we are so blessed to have Dr. Seenan here with us to answer your questions. But we also have an amazing PAD warrior out of Scotland with us as well. We have Kathy, who is involved in a lot of research in Scotland, along with Chris's team. And she posted in one of our Facebook groups for the United Kingdom, hey, are you being offered a walking program? Walking is the best medicine. And I'm curious from Kathy's perspective, what were some of the responses to your post in wondering about the availability of walking programs for patients with peripheral artery disease in your region?
Hi there. Well, I asked this question because when I started working with Chris's team doing sort of a clinical review, I was blown away to discover how many different clinical trials had been about supervised walking programs, all of different lengths, all slightly different, but many, many of them, thousands of them, in fact, all written up, all demonstrating that walking benefited. Now, I discovered that when I started working with them about 2019. Whereas I'd been walking about with this illness since at least diagnosed 2006, probably the 10 years before as well. And I was jaw dropped that all this information was out there, but there was nobody actually telling you this other than just go away and walk. I was already walking. I did not arrive for this diagnosis overweight or diabetic or walking with a limp. I was running 10K races when this diagnosis came along. So walk wasn't really going to hack it for me. And I tried for a long time to find out what the magic formula was. I didn't. I kind of half-heartedly did sort of interval training on a treadmill. I bought a treadmill. I started interval training. I tried to run a bit, walk a bit, and all this. And I did the best I could. So it was a bit jaw-dropping to discover this. So I started to investigate a bit, wonder how many people are offered this walking program, because so much of the research would refer to the best thing to do is walk, but take up on walking programs is low. Well, it's going to be absolutely zero if you're not offered one. You can't take up something that's not offered to you. That's like saying people are not adhering to a prescription drug they're never prescribed. That's mad. So I've often wondered just what's out there, and it seems to be not a lot. But some people are offering it and offering it quite well. And you're thinking in the UK in particular, it's not that big a country. It wouldn't seem rocket science to adopt a programme from somewhere else. But I think mainly it's down to money. And as you pointed out, funds are scarce and health professionals are expensive. And the time has to be best directed. And do we actually need a health professional other than the design of the thing? Do we actually need a health professional in there? We are walking. We're all walking every day. We're walking to the bin. We're walking to the shops. We're walking the dog. We're walking down the yard. We're walking. So do we need a health professional to tell us every time how to walk? Or do we just need somebody involved in the programme and a disclaimer on it that says, I walk at my own risk? Would that let everybody off the hook and let us be able to promote the idea of walking and walking in the way we know works? So that's where I started from with this. And it was a bit eye-opening because the responses were very mixed. Most people haven't been offered things. Somebody was offered what looks like a gold standard programme, and they certainly seem to have benefited from it. Someone else is going to be offered that, but is currently months waiting to be put on it, despite the fact a vascular surgeon says they've got PAD. And I know that the earlier you start this, the better the outcome. So it seems to be that people are not being given the information they need at a key point. It's no good telling people to just go and walk as much as they can. It just isn't enough. So
Yeah.
how do we simplify this to make it more accessible to people, and how do we get people to be referred to it without having to go through miles of clinical research? It's not like there hasn't been umpteen programs of clinical research showing that
Yeah,
it
it's
works.
so interesting. They do the research, they get the money, they do the research, they know the walking programs are great, but then once they have the results that say, hey, the outcomes are fantastic, they just seem to fall by the wayside and then nothing
I
comes of
presume
them and we can't figure out why.
you can't get the health boards to adopt, but Chris will have a better idea of that. I think you can't show benefit, Kim, is the problem. But I'm living benefit. I am actually a living example of benefit. I still have both legs. I can still walk.
But is that because I don't know that in Chris, I'd love for you to step in. I mean, I don't know if it's about a 3 month program or implementing a lifelong program. What we find here in the United States in terms of studies for cardio rehab is that half the patients don't complete the
Mm.
rehab. And most of the patients, more than 90% of patients who go through one of these rehabs for 3 months don't continue with what they learned in the rehab program afterwards. And I'm wondering if that could be one of the reasons why the facilities are saying, hey, you know what? We know walking's the best, but it's not worth us sinking all of the money and time into it when most people don't even continue to comply. The most vulnerable patients can't even afford transportation to get there a couple times a week, or here in the US in particular, the copays that go along with it. And then even more is that you have millions of people that have peripheral artery disease, and there is no way to fit all of the patients that are diagnosed with peripheral artery disease into a program. Now, that being
Mm.
said, that's not stopping them from offering a cardio program, though. So it is a little bit confusing. Dr. Seenan,
Yeah.
Kathy and I can sit here and talk forever and go back and forth, but we
No,
should let you into the conversation.
no, thank you so much. Thanks for having me once again. And yeah, this is a fascinating discussion, and this is absolutely the kind of the crux of our research. And what most interests me about this is this um, perplexing conundrum of, where we have this condition where we know what works, we know what helps, but we don't seem to do it. And why aren't we doing it, or why aren't we, when I say do it, provide it? A couple of things, I suppose, and these things are probably going to help illustrate the difficulties in this situation. First of all, about the research and the guidelines. So, as you say, we have numerous studies that have thoroughly demonstrated that supervised exercise works. So that's fantastic. So we know that exercise works for this condition, and then everyone should be heartened by that, is the fact that there is something that you can control, that you can do, that can make a difference to your condition and make a difference in terms of walking distance, in terms of general cardiovascular health and quality of life outcomes. And that was really nice to see in the answer to your question there, Kathy, as well, on the Facebook group, is so many people saying, yes, I was referred and I did it, and it's made this difference or that difference, and it's been really useful. So that's good, first of all. I think to come back to the research and why, because you mentioned that there is, is it supervised research, or is it just walking? Is it lifelong walking that we should be doing? And it very much is that, the reason that these 12-week programs are recommended is because that is what's been studied. So we have this really kind of strange situation where, obviously, to do research, we often have to kind of put things in quite neat boxes so that we can kind of implement them and then look at the effects before and after and compare them to other things. What that means is that we often look at things or test things that aren't necessarily what we'd want to do in real life, or what we think it should be done for practice, but what just fits in the kind of the schedule for the research project. So certainly the supervised exercise isn't the only way. It is just the way that has been shown to be better than general advice to walk. So what you're reflecting on is that this advice of just go home and walk doesn't work for people. What works is getting in a room with others, or having some sort of social support, or having the guidance and the reassurance, but from a healthcare professional to kind of say, oh, you're doing the right thing. Now push yourself to this level, or do that bit a bit differently. So that is what, but the key thing that underlies all of this is just to walk. So I think that is the other thing to get home. So with all that in mind, then comes this, well, why isn't it? Well, if we know that it works, it's in the guidelines, why doesn't it happen? And I think, I don't know, and this is what we're looking into at the moment, but why is it not happening? To my mind, what I can guess, or what I can gather from talking to people in the field, is that it is to do with funding, to do with commissioning, and that's how it works within the UK. Is that these services are commissioned by trusts, and the kind of problem is no one's really willing to pay. Or I think what I'm getting is that it falls within this gap where the vascular services, who normally treat people with peripheral arterial disease and claudication, they're interested in vascular surgery. So they do the surgery, but they intervene when it's needed. If you have peripheral arterial disease, but it's not got to the stage where it's bad enough to need a procedure, the vascular surgery team's kind of like, well, you're fine, just go away and walk,
Go
and
walk.
they pass it back to the GP, or the family physician, and then the family physician is like, well, that's fine, yeah, so I'll give you your medications, but I don't have capacity to provide an exercise program for you, because if I provide an exercise program for you, I also have to provide it for Mr. Jones over here who's got cardiac disease. I've got Mrs. Smith over here with COPD, and I've got etc., and the people with cancer, and so it falls this where the kind of primary care or GP practices can't fund it. Vascular surgeons don't feel they should fund it, and so then nobody funds it, and it doesn't happen. It kind of falls in the middle. And I don't know, I guess it'll be different in the US and elsewhere where the funding system is different, but that is the essence of it. It's like nobody is taking responsibility for providing this, or who is it that takes responsibility for this. And along those lines, you mentioned the adherence. That is the problem in the studies as well, is that even though supervised exercise work, it's definitely not perfect, because it doesn't fit with a lot of people's lifestyles, and it's really hard to adhere to. It's really hard you often have to travel so far to go to it. It's like multiple times a week. It's not conducive. It's not a sustainable way of doing walking. So that is what we are looking at in our research group, is about how to repackage this, how to do this in a different way. And so things like your app might work for some people. Other people, it might be a local walking group, might be their thing. For other people, it's a treadmill in their garage. For other people, it's getting referred to their local gym. I don't know. And I think that's the nature. It's going to be different from each individual. There's not going to be one thing that works for everybody. And it's about trying to understand and provide that. One final thing to say on this is just that one of the most interesting and most successful places that's developed something is the Netherlands. So the Netherlands have this, what they call Claudication Net. And what that is, it's community walking supervised by physiotherapists. So when you get diagnosed with claudication, you are immediately referred to a physiotherapist for a year. So you get a year-long contact, and they meet with you to develop an individualized program that suits your lifestyle, that suits your needs, and you do that within your local area rather than needing to travel. And I think that is perhaps what we need to be emulating elsewhere.
I think that that's brilliant. You don't need, it doesn't seem that you need that much time with them, but especially if it's remote and it is a full year, where you're just checking in with someone and you have a program that is developed that fits into your lifestyle, then I think the adherence probably is a lot greater.
Mm.
And we hear from a lot of patients because here in the States, we have, for example, Vanderbilt University and a couple of others that have aligned on creating a page on a website that talks about this is how you need to walk effectively to grow your collateral vessels and relieve your claudication. And they talk about setting aside 45 minutes to an hour in order to be effective. And the number one thing I get from patients is, I don't have time for this. Number two is I can't even make it 2 minutes. And you're telling me that I need to set aside 45 minutes of walking, which they say should take you an hour and a half. So you're having to set aside an hour and a half of your time every single day. Now, there are a lot of people, a lot of healthier people that do set aside an hour and a half every day to go to the gym. And that includes going to the gym, traveling to and from, going on their elliptical or whatever their cardio is, and then they go into their weightlifting, whether it's arms one day, legs another, and they do that. But for the majority of people out there, that's just not realistic, especially ones that have their family that they have to contend with, and a job, and other things in their and commitments in their life. So what we do with our program is we say, hey, you just need to set aside 30 minutes of time each day, as many days as you can do each week, the better. And then get as many minutes in that 30-minute time frame that you can of walking. And over time, the number of minutes in that 30-minute time frame are going to increase. And that to me seems to increase adherence. And I don't know what your thoughts are on that. And maybe it's not perfect, but it seems to be working more effectively than to throw out and say, you need to be walking 45 full minutes, and it may take you 90 minutes to do it, but that's what you need to do.
Yeah, I would totally agree. I think that about I think that's well-meaning advice, and it's based on research, which is great. You know, it's saying "Well, this is what this is," but what's off-putting about that is the inflexibility of it, and the kind of black and whiteness of it. Is this or nothing? I think what's more useful is to kind of the advice that you just need to do whatever works for you. The best exercise is the exercise you do, and whatever fits around your lifestyle, and that will develop and it'll change over time depending on your circumstances. So I think, yeah, I would agree.
And so I want to get to Kathy, and we have quite a few questions coming in. Sunil will get to yours. Also, Douglas will get to yours as well. Kathy, go ahead.
I just wanted to raise the point, it's not often mentioned, but I have seen it occasionally, about the benefit of fidgeting. Fidgeting, and there's a difference between walking and not sitting. And one of the things I've always done is get up in every single commercial break if I'm watching television. I get up. If I don't, I used to always walk for phone calls and work. I would take every opportunity to not sit. Now, you're not actually walking, but you're not sitting, which means your legs are straight, you're on your feet, you're doing something. So your sitting length is reduced, even although your walking might not you won't be doing the 45 minutes. And this was one of the things that came up in one of the studies I was involved with Chris, was about counting steps or actual moving steps. So like length of time in a treadmill as opposed to steps at the end of the day. And I see it's often discussed on your pages as well, Kim. And some people say, no, I only count the steps I do in my therapy walk of 30 minutes. But I count all my steps because those reflect my actual active day. And given that I've been living with this disease the length of time I have, with relatively stable disease, maybe I don't need to walk as much now that I'm 74 as I did when I was 54, when I had it as well. But I need to be active. And I've found that just not sitting is a great way of staying a lot fitter. So that's less daunting for people than I can only walk 2 minutes. I'm not going to walk 40 minutes. But you can get out the chair. You can get out the chair every time a commercial advert comes on. Walk round the island in your kitchen, walk to the end of your hall, walk anywhere, just walk and move around. And I think there's a huge benefit to be had. And there is research on this to show that if you fidget and if you alter the way you do things, keep your hands moving, even knitting is an activity that will actually help your general capacity and enable you to walk further. So I think it's people should look at it in a more holistic approach rather than they just sign off. It's like, I can't do 40 minutes. I couldn't go out and walk for 40 minutes, not a chance. But I can walk and I can get through my life. So, It depends on your age and when you're diagnosed and things like that. It needs to be personalised, but I don't think people should get. It makes it too easy to sign off if it's an unrealistic target. And I think 30
Yes.
minutes is a great goal. But if you can't do 30 minutes, so what? Do what you can. But most importantly, get out of your chair, I think, is a message we want to get to people, and get your employer to get you out of your chair. A standing desk that can alter to sitting, or stand up every time you make a telephone call. Anything, I just wanted to say that.
Dr. Seenan?
Sorry, yes, I would totally agree. I think that is as I say, it's whatever works for you, and certainly breaking up your sitting, moving when you can move, and counting all the steps in exercise are important, that you do those and you are pushing yourself. If you want to see that improvement in walking distance, then you need to be pushing into those steps. But all steps count. All movement matters. So yeah, do as much as you can.
I want to get to Sunil. Sunil, go ahead and unmute. And you have a question. You have the very first question that came in today. Do you want to go ahead and ask it yourself? Go ahead and unmute, or I can ask it. There he is, all the way from South Africa. Thank you so much for being here. Go ahead and ask your question. You have to unmute.
Yeah,
There
can
you
you
go.
hear me, guys? Okay. Yeah, my question here is pertaining to walking as we are discussing it. I can say, okay, I'm hearing you guys. You are saying there is a program that you all have that has been working. I just want to know. Me, I started nobody for me. I just had to go on the internet because the doctors weren't helping a lot. I started walking. Then I realized that it's helping me to cover more distance. I'm starting to cover more distance than I used to. And it's also helping me with the pain. The pain is much less. And my muscle is much stronger than it was before. So should I carry on with my walking the way I do my thing? Because I jog sometimes for 5 kilometers, for 10 kilometers, or should I get onto this program you are discussing? That is what I want to know.
Dr. Seenan?
Hello?
Yeah, thank you. Sunil, thanks. It's a really good question. It sounds like to me, what you're doing already is working really well for you, and it's something that you are managing to sustain and do again and again. And as you said, if you're able to go further, if you're managing to walk further without pain, or go for further distance in general, then I would stick with what you're doing. I mean, if you feel you would like support and you would need to talk, you want to talk to someone or even link in with other people with a condition to kind of get reassurance, then yes, do the program as well. But certainly don't stop what you're doing to switch to this program. I think what you're doing sounds like it's working really well.
If you're feeling a relief in symptoms, then you know it's working, because Dr. Seenan, walking does work. And you said in one of the recent interviews that we did that it takes about 6 to 8 weeks sometimes to start seeing that symptom relief. And if you're not seeing that symptom relief, then it's time to do something different, because walking truly does make a difference. And we do have the app through the Global PAD Association, Sunil, and anyone else who's listening, and it's free. And it walks you through a regimented walking program and allows you no cost to track your claudication time. And that claudication time is the moment you start feeling pain to the time that pain forces you to rest. And so we're really looking at how much you're walking through the pain. And maybe Dr. Seenan, you might take a moment to explain why walking through the pain is key, because there still are so many patients and doctors that are talking about, well, you know what, when you feel the pain, you just need to rest. And I had one woman, Dawn, who said, if my doctor would have told me that the pain was good and I should have walked through it, I might not have lost my leg.
Mm. Yeah, and it is it's a good point. It's an interesting area of practice, I think, because there is a bit of a debate growing within the literature about whether or not all the exercise needs to be into this pain or not. However, what the point you just made there, Kim, that sentence about the pain is a good thing, or it's certainly it's not causing you harm. It's not harming the tissues, and it is one of these what we believe is to be a kind of a key mechanism to help that collateral growth. So when you feel the pain, that means that it's the used to talk about it as it's a bit like your muscle is a bit like a small baby. So it cannot communicate. The only way it can communicate is crying as a small baby. And for your muscle, the only way it can communicate something is by kind of making you feel pain. And so what it is telling you when you experience pain is that it needs more oxygen. It's crying out for more oxygen to get there. And so it's trying to tell the heart to pump harder and pump more blood down into the legs. And what that does is that can help stimulate the growth of these collateral vessels around the blockages. So walking into the pain is a good thing for kind of helping the circulation within your legs. So yeah, certainly, yeah, that's a really important message to take if you haven't heard that before. But that is not to fear that pain in your legs, and the more you can walk into it, the better.
It's kind of like going to the gym, right? You're working with a trainer and you're doing those bicep curls, and the trainer says, just give me one more. And you're like, no way, no way.
Yes.
I can't do it. And they're like, yeah. And you're like, oh, I did it.
Yeah, exactly. And I think many people kind of they feel that, and they feel that once you push through it, or if you can push into it for as long as possible, because as you know, as many of you know, and the experience is different for each and every one of you, depending on whether, because in terms of where you feel that pain, the intensity of the pain, how it comes on, what it feels like. So, I don't want to be blasé about this and say, or, just, yeah, keep walk into your pain when I'm not experiencing it day in, day out. I know that sometimes it's something that's not possible to do. However, as much as you can, as much as you're able to, yeah, push into that pain.
And I shared it on LinkedIn, the story of a young woman who ended up with bypass, and then it failed and she ended up with a fasciotomy, and the doctor said, well, you know what, there's nothing more I can do. It's going to be up to you, because the next step is going to be amputation, but go home and see if you can walk through this. And she came to me and she was like, I don't know how I'm going to do this. And I'm like, we're with you every step of the way. The pain is good. I know you're going to cry. Walk until you're going to cry. I said, well, it's going to be about 2 seconds before I cry. And I said, that's fine. Then for those 2 seconds, go ahead and just try to push through, and then stop and rest. And now we're just a few months later, and she said, oh my gosh, I now am walking without pain for 30 full minutes. I have my leg, I have color in my leg. But she said that when she first started, that she actually felt like her leg was going to snap off. That's how bad the pain was. And so know that you're not alone. If you're just listening to this for the first time and just getting ready to start a program, that here's a patient that started out with that feeling of a tourniquet wrapped around her leg so tightly, and all of her muscles and nerves and everything were screaming, to the point she felt like her leg was going to break off if she took another step. And here she is months later, and she's walking 30 minutes without any pain, which to me, it's just mind-boggling.
Yeah, it's an amazing result, isn't it? Yeah.
Douglas, go ahead and unmute and ask your questions. I know you have several of them.
Yes, doctor. Good to see you again. Great to have you with us again.
You too, Douglas.
So imagine, I'm going to give you like maybe two quick scenarios. I'm in the hospital and I can't walk, but I'm laying in the bed and I'm going to be in the hospital for a little bit. Or I'm at home, it's raining, it's too much snow or something. I'm sitting on the couch watching TV. Or like say I'm doing my woodworking, I'm standing in place doing my woodworking. Now, the idea behind this is if I'm doing calf raises, if I'm laying in a hospital bed and I'm moving my feet to that, like the alphabet, or I put a towel on the floor, I'm sitting on the edge of the bed and I put a towel or a paper plate and put my feet on them and move them back and forth. Is that necessarily creating the circulation I need to help build and keep my collaterals?
Yeah, good question. I think that It depends on the intensity of how fast you're moving. So certainly the movement will be good. So any, as you say, kind of moving your ankles, doing the alphabet, or any sort of kind of movement on the, if you can get your feet going back and forward, it's going to be good for you. So do that, absolutely. In terms
Like,
of whether or not it will help stimulate or maintain your collaterals, it's about, again, I guess your best guide is your pain. So if this kind of exercise is causing an increase in your heart rate, if it's causing you feeling a bit of pain within your leg, then yes, it will be helping. If it's just feeling like you're kind of wiggling your legs around and it's not really causing you to work very hard, then it's not likely to be making much difference.
and with that thought, so we can buy those little machines that we put on the floor and we put our feet on, and they move our feet back and forth. Now that is, if you see them with the like the little leg, the clasp on them where you stick your feet in. Now it's moving it's moving its own. Is that necessarily doing anything? Because I'm not doing the actual work really, if
Yeah.
that makes sense.
Absolutely no. So that's not going to be particularly helpful either, because if you think about what you need to do to help with your circulation is get your muscles to be working. So they need to be producing the force. They need to be, active and contracting. So if the machine or whatever you're on is doing the work for you, then your muscles aren't really going to be working very hard. The best thing in these situations is like one of the, you can get almost like it's like a stationary bike, but pedals, so you're going to be pedaling away, but it's just sat on a platform on the floor, and you can kind of change the resistance. And therefore, if you're pushing into this resistance, or get one of those, we call them TheraBand in the UK, but it's one of these elastic kind of latex exercise bands, and you can be pushing your feet into them to exercise your legs.
Yeah, and we get that question all the time because you have certain devices that are out there. For example, there's a very famous one here in the United States called QB, and it costs more than $300. And I have family members and I have patients who call us and say, "Hey, should we be getting this for our family member? I mean, is any movement good movement? Should, just to move the feet?" But it sounds like it's not worth the investment because the best movement is the one in which is going to be you as the individual initiating that movement so that the
Yeah.
muscles are working.
Yeah. Yeah, that's it. I mean, and I've not come across QB. Is that spelled CUBII? Is that right?
Yes.
Yes. Okay. I'm gonna have a look at that and see what it's all about. But yeah, that's the key thing. Whatever you're doing, and it doesn't matter what you use. If it's as you said, as Douglas says, a paper plate or something else like that. If it makes you do the work, if your muscles are producing the action, then that is going to be good for you. It's going to help.
Here you go, Kim. I
There
got
you
Yeah.
go.
one of
He's
those,
got the
and
bands.
this is my stretch band that I use when it's raining sometimes, and I
Brilliant.
put that on my feet, and it actually makes you do the work.
Yeah, they're fantastic because they make your muscles work really hard, kind of pushing it away and controlling it as you come back. So they'll be helping. They'll help a lot. So I'd recommend those. And they cost what, 50p or a pound, a dollar? I don't know. They're very cheap. So it might, rather than spending £300 on something, buy 300 of those.
It's interesting that you were talking about the fact that you need to initiate the pain. That's when your body's really working, particularly for people who have claudication when they walk. They have the poor circulation known as peripheral artery disease. Because Sunil was also mentioning in the chat here about he feels less pain when he is jogging compared to walking. And Kathy mentioned earlier on that she used to be a marathon runner, but then when she was walking, that she had the claudication. Is there some sort of difference between walking and running that I don't even know how to phrase this question
Hmm.
that makes it so that you need to walk versus run in order to improve your claudication?
Yeah. So I think to kind of answer the first question about, well, why does it perhaps feel, why do you feel less pain running compared to walking? And it will, I think, more than likely be due to the way that your legs work differently in the two actions. So when you're walking, your calf muscles generally are producing a lot of the effort to kind of push yourself forwards, and move yourself forward over the ground. When you run, that changes slightly because your calf muscles are still working quite hard, but you end up maybe using your thigh muscles, your kind of upper leg muscles a bit differently, and even your glutes in your bottom. So and it might just be that change in the way that which muscles are working when might affect, well, they will affect how the kind of type of pain you experience depending on where your blockage is. So, for some people, running might be worse than walking, and other people, walking is worse than running, and so on and so forth. So, in terms of, is it worth doing if it's not causing the pain? Absolutely it is, because again, I'll say, I mentioned this before, but if you remember, there's kind of two reasons why we walk, or two main reasons why we walk. You walk, one is for that growth of the collaterals and to be able to walk further without pain. The other reason is for your cardiovascular health and to prevent any other kind of reduce the risk of the other cardiovascular conditions like a heart attack or stroke or things like that. And so the running, even if it's not perhaps kind of stimulating that collateral growth and making you walk further without pain, it will be really helping you with your cardiovascular health, your strength of your heart, the strength of your lungs, the ability for your body, the health of your body to pump your blood around your body. So do both, do it all, but kind of understand that you maybe be doing them for different reasons.
And we have Lynn S. that has a question. Go ahead, Lynn, and unmute and ask Dr. Seenan your question. It's good to see you again. See if we can get you to unmute here. There you go.
Hi, sorry, I'm on the fiddly phone again. Yeah, so about 10 years ago, I did the Couch to 5K, and I was very pleased with myself, but I couldn't go at a great speed, and I could never, ever do the 5K within 30 minutes, which was the ultimate goal. And I could never do it outside on the street either. It was always on the treadmill. So 9 months ago, when I got diagnosed with PAD, I could probably, my maximum speed of walking was probably about 2 kilometers an hour. And I would cry at 10, 15 minutes. That would be enough. But now I've bought myself a walking pad, and I can go straight in at 3.5, 4.5 kilometers an hour, and I can walk for a good half an hour, and the pain's there, but it's not unbearable. When I try to knock it up to 5 kilometers an hour, I'm kind of having to break into a bit of a jog, and I'm just not built to be a jogger. And I've never been really a jogger. But my question is, when I was doing my Couch to 5K, quite often what I would call normal cramp feelings would set into my legs. So when, have we all got a speed limit, I guess, is what I want to know. Have we always got to think that the pain that we're experiencing is from intermittent claudication, or can it be just normal cramp associated with the muscles that we're using, especially at our more mature age, to walk at speed and length?
Yeah, good question, Lynn. And first of all, well done on the Couch to 5K. That's fantastic that you were doing that, and even that improvement in the speed that you're able to go. That's great, and hopefully that makes a difference in your day-to-day life and what you can do. In terms of, when is that kind of normal cramping pain? I'm not really, I guess. I'm not really sure how to. I suppose I would suggest that, you shouldn't someone without peripheral arterial disease may not feel any sort of pain, at any speed. You would maybe get with a cramp pain, I would think about in relation to exercise is often after you've finished exercising. And, if you've worked your muscles really hard and it's a cramp that happens as a result when you're resting almost after you finish the exercise, or a pain that you get the day following going to the gym. I would suggest that, any kind of sort of cramping feeling as you're walking that kind of comes on when you're walking, and if you slow down or if you stop that it goes away, then that is always claudication pain. Am I misunderstanding kind of what you're describing?
No,
Sorry.
no, you're getting it. You're getting it right, Chris. I mean, I don't think that I can. My walking pad just knocks up 0.5 kilometers every time. It doesn't go on ones and twos, which is a bit of a nuisance, really. But hey ho. I don't think that I can walk. Like you say, I can't go any faster than 4, but my little legs won't go any faster than 4.5 kilometers
That's
an
okay.
hour.
That's fine. That's great.
I don't think I'm ever going to be able to go any faster than that. And as I'm saying now, I can easily do 30 minutes, 40 minutes at 4.5 kilometers an hour with hardly, with bearable pain. Shall we say that, with bearable pain? I usually do about 2.5, maybe nearly 3 kilometers. And it's time I get off. I'm bored out of my brains. I watch the TV, but there's only so many Christmas rom-coms you can watch before you get, fed up. So I just don't think I'm ever going to be able to get any faster. So does that mean that I'm at my limit, I guess, is what I want to say.
Yeah, I guess what would be important is, well, what's your goal? What's your aim, and what you're trying to achieve? Because certainly what you're doing at the moment is great, and I don't think you necessarily need to go faster unless you want to for a certain reason. So is it that you want to go faster because it would allow you to do X or Y or something like that? But I mean,
it's because I don't want any pain. I think that's what we would all like to achieve.
yeah,
Zero pain.
I see. Right. And yeah, that would obviously be the best outcome possible. It's possibly just that it's not realistic for you in where your blockages are and how they're developed without kind of, so there's a limit to what exercise can probably achieve. It's not going to make the blockages go away. We'll grow the circulation around, but those extra channels aren't as wide or as thick or as well developed as your kind of initial ones, and therefore you might not ever get to the point where you're walking without pain completely. But certainly, as you can see, your distance will increase. How far you can go increase, but and that maybe doesn't help.
But what's interesting is that Kathy's mentioning interval training, and just a few moments ago when Douglas was asking his questions, you were talking about strength training as well. And so if you've maxed out on your walking, you feel like you are at your limit there, maybe combining it with some other things, half raises, using those TheraBands, and doing a little bit more strength training as well. Dr. Seenan, am I correct in saying that it would also be a great addition to help improve the symptoms?
100%, yeah, because the thing that the strength training does, and I think we talked about this with Dawn in one of the previous kind of chats as well, is that it can improve the efficiency of your muscle. So basically how much oxygen it requires to produce the contractions that it does. And so that is absolutely, that's a way that you might be able to get additional benefits. And I'm seeing in the chat here as well, Josh was suggesting jump rope. Yeah, I think skipping is another brilliant exercise. And as Dawn says, it brings on claudication depressingly quickly. And I'm not surprised, because if you imagine what you're doing on skipping is just repeated heel raises. So if the pain you experience in your calf, then it's likely to bring on the pain very quickly. But to get that variation to keep you interested in the exercises, I think, and to kind of challenge your body in different ways. Try all of these different things as much as you can.
Thank you so much, Dr. Seenan. We really appreciate your time in being here, and we're coming up on the top of the hour. So we'd love to have you back. We always get so many questions in, and you're such an inspiration for so many. And as we started this entire session talking about every doctor across the globe is saying walk, 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 but no one is talking about how. I think that having this session with you is providing so much hope for so many people, and we'd love to kick off the new year with another session on a Wednesday with you, either the first or second week, whatever works for your schedule.
Yeah, that would be brilliant. I would love to. I mean, I can certainly do the 8th of January if that would work for you all. That would be brilliant.
I think that would be amazing. Thank you so much. We'll plan and make sure you like this video and subscribe to our channel, and I will be getting up a scheduled promotion for the 8th of January onto our YouTube. So make sure you go to youtube.com/@, the way to my heart, and subscribe to the channel, and you will get notified when Dr. Seenan is going to be on to answer your questions.